prednisone and drugs like prednisone, budesonide, fluticasone, those are inhaler steroids. Then there's methylprednisone, dexamethasone, decadron, kenacort, triamcinolone. These are all corticosteroids. And why am I talking to you about this? I'll tell you why. These drugs are lifesavers, but they got serious, serious problems. Yeah, they can treat arthritis. You take a steroid, boom. It's for swelling secondary to an autoimmune related illness. Colitis, like Crohn's disease, ulcerative colitis, blood disorders like lymphoma, leukemia, hemolytic anemia, asthma, bronchitis, breathing problems, shortness of breath, allergic reactions, anaphylaxis to drugs. I use Medrol dose pack all the time. Methylprednisolone. So these drugs are a lifesaver. They stop the body when the autoimmune system is going haywire. Guess where else they're used? COVID. The COVID may cause a cascading series of events in the immune system where the immune system becomes hyperactive and out of control. Dexamethasone is a lifesaver. Head injuries where the brain is swelling, they give you IV decadron. Dexamethasone, just a longer acting form of prednisone. All these drugs get converted into prednisolone in the liver. So if you cannot convert to prednisolone in your liver, they don't work. Like people in liver failure, alcoholics, skin rashes, injuries to your shoulder or knees or arthritic problems, they inject cortisol or hydrocortisone. These drugs are lifesavers. So why, Dr. Agresti, are you doing a video saying they're big trouble? I'll get to that. Cataracts, immune disorders like lupus. These are transplant patients. You have a new kidney, new liver, new lungs. It prevents the body from, it slows the immune system down, so it prevents the body from attacking itself. Now, how does a psychiatrist get so intimately involved in corticosteroids? I'll tell you how. They make people really, really depressed. Or they can send someone into a manic episode. But I'll tell you one thing. They are absolutely addicting. They make you feel like you're 16. They energize you. You feel uplifted, energized, not sleeping, restless. But you don't stop talking. You're really obnoxious, and it's like a pain to live with someone because they have always something to say. They get irritable. They have no frustration tolerance. Mood swings. They're happy, crying, yelling, screaming, but they don't shut up. Their personality totally changes. You get a calm, mild-mannered person turns into a blabbing, annoying, obnoxious, irritable person, and they get psychotic. I had one guy. He was in traffic. He's on US 1 in North Palm Beach. For whatever reason, the light turned green and the person in front of him didn't go. He gets out of the car with his golf club and gets on the roof and starts banging. And he doesn't stop. He went totally psychotic. I had someone throw a 45-pound, round, huge weight at another person in a gym. I'm lucky he didn't hit him. Could have killed him. Oh, I had someone come in a rage. He beat up 3 or 4 people in the emergency room. And yes, I've had people on steroids try and bite and eat people. So that's locally that happened. I've had people do some really bizarre thing on steroids. They're absolutely the high, the euphoria, the super capabilities, the energy, the not need to sleep. People get addicted. And oh, yes, there is a withdrawal. Fatigue, nausea, vomiting, you don't eat, you feel terrible, total, just no desire to do anything. Your abdomen hurts, fatigue, nausea, vomiting, sweating, They sort of lie around, don't eat, and just act like someone drained you of all your blood. What are the side effects of these? The biggest one I just talked about: the depression, mania, euphoria, restlessness, insomnia, mood swings, personality changes, psychosis, aggression, annoying personality, irritable, don't stop talking. That happens right away. So some doctors say, oh, you're having an allergic reaction to the drug. Here's a Medrol dose pack. You're getting a rash, or you have problems with your shoulder or your knee or your hip, or you have an injury. You're having trouble moving. Here's steroids. Well, you get all these things happen right away. What also it does, you retain sodium. And you eat too damn much, so you get fat, you retain fluid, your ankles swell up, your face gets puffy. And you retain all the sodium. Yeah, your blood pressure goes up. And what else it does? It hypes up your heart and gets you pumping and gets you moving and aggressive, and your heart's pumping, and it depletes potassium, so you get arrhythmias, you get headaches. Some people who use too much get nausea, they don't sleep, they vomit, their skin, people have been on it too long, like my transplant patients, kidney patients, liver patients with new kidneys and livers, they get easily bruising. They got all these blue spots all over them. It's from steroids. And older people who've got lung problems, asthma, or chronic rhinitis, bronchitis, infections of your nose and your lungs, who've been on steroids for long periods, they get this easy bruising and these purple spots all over. That's the hemoglobin spreading and the vessels rupturing. They hiccup. I don't know. They just start getting hiccups out of nowhere and get this big puffy face. Here's a great one. Women get facial hair, and then their hair gets thicker and their skin gets all kind of acne and rotty and like it looks like the moon. It's all potholes and acne and hair coming out and oily. Steroids. You bruise easily. You get cataracts, glaucoma. Here's a good one. Chest tightness. You know what it's from? Stomach ulcers, duodenal ulcers, gastritis, esophagitis. What that means is redness, irritation of the stomach, the esophagus, and then you get hoarse because your larynx, where your voice is generated, gets irritated. People get obese. They get diabetic. Vision problems, congestive heart failure. And they get like inflammation of their vessels. Oh, women get irregular periods or they stop having their periods. I had one patient get pancreatitis. So steroids, corticosteroids, which are used commonly for asthma, bronchitis, rhinitis, rheumatoid arthritis, lupus, Crohn's, autoimmune diseases, rashes, drug reactions, skin conditions, injury, trauma, for COVID. So they're miracle drugs. They let you breathe when you can't breathe. They let you move a part of your body when you can't move it. They stop, like if you're nephrotic syndrome where your kidneys are shutting down, they could be life-saving. Stop your kidney, if you get a transplant, stop it from rejecting. They addicting? Yes. Do they cause a high? Yes. Do they have a withdrawal? Yes. Do they have a lot of bad side effects? Yes. So everyone gets put on steroids at some point. Someone has some injury, a cold, a skin rash, a drug reaction. Everyone gets it. So you need to be aware. They change your personality. They change your body. I had one guy come in. I'll call him John. And he came in. I'm like, this guy was very fit. He looked like he was in good shape, and he was. He was an athlete. He did all that biking stuff. And I'm like, what happened to you? You look like crap. Well, he had some hair loss from the steroids. He had acne. He must have gained 100 pounds. He got addicted to them. He liked that up, feeling strong. And he had back problems and knee problems. And when he took the steroids, he didn't feel anything. Not to mention, I think I mentioned most of the bad things, but I got him off. Boy, did he go through withdrawal. He had been taking them for years, and he had been taking them illegally. So that's my little bit on corticosteroids. They're good, but man, do they have problems. I appreciate the likes, comments, and subscribe. And my book is on Amazon.com. Tales from the Couch. Here. Get a little peek. Buy it on Amazon.com. Mark Agresti, Tales from the Couch. It's a great book. This is like the best book I've ever seen in my life. It's the best book I ever read. Buy the book. Bye.